Good morning.
Morning, Dave.
Good morning.
Two more board members to have a quorum. One more board member, Lindsay, and we have a quorum. Oh, and Dr. Wallace. Okay. So we'll hold till 9 o'clock to formally start, but we are good to go with a quorum to conduct business.
Good.
Good morning, everyone.
Good morning.
Good morning and welcome.
We're glad you're here.
I'm glad I'm here, and all of you.
Good to see you, Tabitha.
Good to see you too.
Well, good morning, everyone, and welcome to the December meeting of the Kansas Children's Cabinet and Trust Fund. I appreciate your attendance. The October meeting was somewhat lightly attended, including me among the absentees. And so I want to publicly acknowledge Leetta Felter and thank her for taking over duties of presiding over the meeting and working through the agenda in my absence. Thank you, Leetta.
You're welcome.
We have a fairly short agenda today, but that doesn't necessarily mean a short meeting because the one and agenda item in particular, adoption of the annual report, will take some time. It's a fairly voluminous document and staff will lead us through it, but thank you for being present for that. First order of business is approval of the October cabinet meeting minutes. I would suggest adopting them by acclamation unless there is objection. Seeing none, they stand approved. Next item is review and adoption of the annual report. Jessica Sprague Jones will lead us through a discussion of the contents of the report. Because it is a detailed report and lengthy, I would ask you to hold your questions and comments until the end. So please take notes and we'll come back to that after Jessica and Melissa finish the presentation. Jessica, you're up.
Well, Don, I'll kick us off just with a broad overview of the purpose this report serves. Throughout the year, the cabinet holds 6 different board meetings, and each meeting has its own cadence. The report is the culmination of all of that work and insight that we gather throughout the year. That if you've gone through it, it's divided this year into 3 sections, which is what Jessica will walk us through. Lindsay, can you go to the next slide? The overarching principles that guide the work are listed on screen now. The purpose of everything we do is focused on ensuring that we are meeting the unique needs of our children, that we're supporting parents in the choices they would like to make for their children, make sure programs are available and options exist so that everybody has what they need to make sure their children are getting the best possible start in life. Our work is really focused on encouraging public-private partnership. Every grant we issue includes a component of community matching effort and partnerships. And we're looking for ways to prioritize efficiency and effectiveness. So Jessica's going to walk through the components that this report includes. It is definitely a summation of the work that we've done this year, and this is the way we meet our statutory responsibility to provide guidance and evidence of the evaluation and the oversight that we give to the administration of the Children's Initiative Fund. We also have other types of funding and projects, so we try and incorporate those. But these are not the nuts and bolts specifics of each of the individual reports, because those all also exist. So Jessica, I'll turn it over to you to walk the board through the components of the report.
All right. Thank you, Melissa. I'm Jessica Sprague-Jones. I work at the Center for Public Partnerships and Research at KU, where I have supported a variety of projects on behalf of you, the Children's Cabinet, for many years, including being part of the large team that contributes to this report. Could I have the next slide, Lindsay? Oh, that's the one I was expecting. Thank you. So I'm just going to walk you through what you can find in the document. Won't be page by page if you were worried about that. It's a pretty high level view, but of course, happy to answer any questions you have about any of the specifics. Starting with the introduction. In this introduction, we're trying to, of course, provide an overview of the document, but also provide an overview of the Kansas Children's Cabinet, what this body has been historically, and some of those guiding principles that Melissa was just referring to. So, of course, we include a letter from Melissa, the director, include information about the people that make up the Children's Cabinet, the cabinet members, ex officio members, and of course, staff, and then articulate the Children's Cabinet commitment to Kansas children and families and approach, weaving together commitment to early childhood, statutory responsibility, and that strategic approach. Next slide, please. So this is one of the visuals that we have developed to articulate the many roles that the Children's Cabinet takes within the early childhood system in Kansas, and as given that responsibility through statute. So as a manager, managing grant making, fund administration, and strategic planning processes, a connector, convening partners across government, nonprofit, and private sector on shared interest in children's issues, a champion elevating the importance of early childhood and contributing to innovative approaches, a strategist identifying opportunities for effective collaboration and for overcoming system barriers, and an evaluator evaluating the use of Children's Initiatives Fund, contributing to data-informed decision-making, and offering practice and policy recommendations. Next slide. Thank you. The main substantive section of the report this year is the portfolio. This section has a big job because it is really geared towards reporting on the full funded work of the Children's Cabinet portfolio, including activities, evaluation results, and highlights. And this year, we have really tried to show those through lines of the guiding principles and strategic direction that are threaded throughout these activities. Next. So the portfolio includes the Children's Initiatives Fund projects, which are both programs administered directly by the Kansas Children's Cabinet and programs administered by other state agencies. But then there's also a federal funding portfolio. There's funding which renews annually. That's one program, the Community-Based Child Abuse Prevention Program, and several time-limited federally funded projects, including CamLink, the Preschool Development Grant, Child Care Accelerator, and Capital Projects Funds. This is just an overview of where we first presented this, or this information was first presented to the Children's Cabinet. As you can see, and Melissa alluded to this, this is information that is presented in detail to the Children's Cabinet throughout the year. So in February, there was a detailed presentation on family well-being work and how it's exemplified in CamLink and CBCAP. April presented ECBG funding recommendations. June is when we present on the CIF accountability process results to support making budget recommendations on the CIF. August, there was a detailed report of the ECBG evaluation and also CBCAP funding recommendations. And in October, there were reports on the impact of the Child Care Capacity Accelerator project and progress on Capital Projects Fund. And throughout the year, there have been PDG updates, Preschool Development Grant updates, pretty much every cabinet meeting. This is the graph that we use to depict how Children's Initiatives Fund was dispersed in FY 2025. So you see that the blocks are proportional to funding amounts, and that they are segmented out into projects directly administered by the Children's Cabinet on the left, and on the right, projects administered by other state agencies. So on the left, the Children's Cabinet was directly administering 51% of CIF funding through 4 programs: the Early Childhood Block Grant, one-time funding for Northwest Kansas Public-Private Partnerships, the Dolly Parton's Imagination Library, and funding for early childhood infrastructure. On the right, the programs are color-coded by administering agency: Kansas State Department of Education in yellow, administered Parents as Teachers, and the Kansas Preschool Pilot. Kansas Department of Health and Environment administered Kansas Early Childhood Developmental Services, Maternal and Child Health Home Visiting, one-time funding for health and safety grants, and the CAPE Workforce Registry, Tobacco Use Prevention, and Kids Network. And in navy blue, Department for Children and Families administered child care assistance. Every year, all programs receiving any CIF funding participate in an annual accountability process This is a process my colleagues at CPPR conduct annually. And we do it by taking a pretty 360 view of these programs. We collect any kind of program reporting that they develop through their own evaluations or for any other kind of accountabilities that they are responsible to. We field an online survey to get outcomes data and outputs data, and we conduct interviews with program staff. My colleague, Dr. Owen Cox, presented the results of the accountability process in the June meeting. And we do that to align with the legislative budget process. We always mention that because it's a little bit off from where we would want to be in terms of data, right? Because the fiscal year ends at the end of June, so we aren't able to report on the most recent annual data for those programs until we scoop it up for the annual report. So we have those data in this report. Next slide, please. The other key accountability practice, evaluation practice that under the banner of the Children's Cabinet is the Common Measures Initiative. This is under an evaluation designed by and implemented by Wichita State University Center for Applied Research and Evaluation. The Common Measures Initiative is a system of shared measurement. So early childhood block grant grantees provide a variety of services that are appropriate for their local communities. So it's really a community-led grant program by design, and you see a fair amount of local variation. That Common Measures Initiative enables a uniform evaluation across that variation to understand overall program impact. Dr. Lynn Schrepperman presents results of that evaluation annually, and she gave a very detailed report in August about those results. This is a high-level top-line picture of those results in the report. We provide details about the evaluation, how it's conducted, and we give some of those key results from Lynn's evaluation, including, some really pretty strong results for 2025. So this year, they found that 88% of parents engaged in positive parenting and 81% of classrooms were high quality. Both of those were 10-year highs. In terms of child level outcomes, 70% of 3-year-olds were on track in early literacy in spring compared to 48% in the fall, and 78% of children were on track in early numeracy in spring compared to 63% in the fall. So really strong results this year. The other signature program directly administered by the Children's Cabinet is Dolly Parton's Imagination Library. This is a program in which families that choose to participate with young children, birth to 5, receive one age-appropriate book a month. You can see from the map that there's good coverage throughout the state in terms of participation. Those counties in green are counties that met the program goal of 65% enrollment of children from birth to 5 in the county. Overall, 43% of age-eligible children participated statewide in 2025. That included 77,000 children, 21,000 of which were newly enrolled. And the program distributed over 900,000 books. My colleagues at CPPR, Dr. Zilka von Essenbein, conducted an analysis a couple of years ago where they took advantage of the fact that we have really great early literacy data because of the Common Measures Initiative on kids who have participated in early childhood block grant. So they took that and they identified children who were participating in both programs, Dolly Parton's Imagination Library and early childhood block grant. And they found that those kids who were also getting Imagination Library made significantly better progress on key measures of early literacy. So really strong support that this is a really effective addition to other high quality early childhood programming. The Northwest Kansas Public-Private Partnership, again, this is one-time funding in partnership with Dane G. Hansen to establish an endowment to support sustainability of childcare in Northwest Kansas. Some of the highlights for 2025 is that this is has generated $11 million in total committed funds for the endowment and 545,000 in investment growth. So far, 150,000 in grants have been awarded to date, including 1 grant request cycle and 2 emergency grant requests. And they're also currently under review for $160,000 in requests to be announced this year. Moving to the federally funded programs reported in the annual report. Community-based child abuse prevention program is a program that renews annually and for which the Children's Cabinet is the designated state lead. These are grants that are geared towards community-driven efforts to prevent child maltreatment. And so they are, like ECBG, quite specific to locale and really encompass a variety of different kinds of services. In 2025, CBCAP grantees provided 2,833 concrete supports. These are things like clothing closets, hygiene pantries, household item stockrooms to meet families' immediate needs, which ultimately promotes well-being and increases household stability to prevent maltreatment. CBCAP grantees also hosted over 600 events and trainings for parents and children. These are things like community baby showers, literacy and education events, and school supply drives. As part of the evaluation, CBCAP collects data on the Protective Factors Survey, and the results from that survey this year found that families participating in CBCAP experienced 31% improvement in family functioning and resilience, 11% improvement in nurturing and attachment, and 27% improvement in social supports. In terms of time-limited funding, we have 2 federal grants that are supporting work that is geared towards improving the systems that support children and families. Preschool Development Grant is supporting the development of a strong and nimble and responsive early childhood system. This year in 2025, this work supported multiple childcare initiatives, including the CAPE Workforce Registry, a substitute pool program, so childcare providers can take time off when they need it, a health insurance stipend program, and the childcare zones grant model. It hosted a Kansas Early Childhood Mental Health convening in October, and this year's Future Fellows program, which is Future Fellows is a program in which leaders from throughout the state learn about foresight techniques and thinking about the future and future planning. This year, that program was focused entirely on the early childhood sector. So a variety of professionals from early childhood participated in Future Fellows. CanLink is a grant that is focused on making stronger connections between early childhood and child welfare services. This year, grant activities identified and implemented opportunities to connect families who are engaged with child welfare services with early childhood resources. They also provided technical support to 5 Family Resource Center innovation pilots. The Child Care Capacity Accelerator was a generational investment in child care capacity to grantees throughout the state. In 2025, Accelerator grantees have created 5,101 new licensed childcare slots, nearly 30% of which are for infants. Childcare capacity is a huge concern. It's especially pronounced in terms of infant care capacity. 4 of these counties had previously had 0 capacity and now have infant slots available due to this investment. Accelerator supported childcare programs have also hired 802 new staff. Another key issue is addressing recruitment and retention of childcare staff. So another great intervention into the issue of childcare capacity. And the capital projects fund grants are geared towards bringing partners from different sectors to construct facilities that meet a range of needs for children, families, and their communities. So what that looks like, of course, varies by these grantees. In Hayes, it's a multi-generational facility that houses the Hayes Senior Center, a child care facility, and a community space. In Manhattan, there's a business incubator that also has telemedicine, primary care services, childcare, and resources for job seekers and adult learners. And then First Steps with Abby in Atchison County is led by St. Benedict's Abbey, and they are transforming a former Kansas juvenile correctional facility into a space for health, education, and care needs of families. The final section of the document, looking forward, includes some information on the Office of Early Childhood and implications for the Children's Cabinet and for the CIF. It also includes the CIF funding recommendations made by the Kansas Children's Cabinet in June of this year, and these are displayed here. That's what I have. Happy to answer any questions.
All right, thank you,
Can you go
Jessica.
back one slide? I wanted to take a picture of that slide. Thank you. Hang on. Okay, thanks.
Okay, we will open it up to questions. I see 2 hands, not knowing which was first. Senator Sykes.
Thank you. I think Tori might have been before me, but I will ask my question. And thanks for going back to this slide. It was actually on this one. But first, I just want to say I was super excited about that 70% and then the 78 on those early literacy and numerical. I think that is amazing. And that 43% of age eligible children for Dolly Parton, like, I think this is like what we need, you know, starting early, like this is how we move forward. But my question is, and I think, Melissa, based on this, and then KLRD, Kansas Legislative Research Department on the budget, my question is, being aware of reductions that have been made from consensus revenue estimates, what are thoughts and ramifications of the SIF funding?
Well, yeah, that's an important question, Senator. It's difficult. The November estimates reduced the outlook for the tobacco revenue from 43 million, which is where it was for the spring budget, process in the legislature. Based on the April estimates, we took in 47 million in April. So we beat the estimates. It's my understanding that philosophically, Consensus Revenue Estimating Group looks at the trends, but they try and they don't want to underestimate they don't want to be off kilter and predict more than we end up getting. So they tend to try and track a few $1 million ahead, like under reporting or predicting where we might land. So I hope it's not as dire as the estimates make it. They reduced the current fiscal year from 43 million to 42 million, and then did a further reduction for FY. It would be the FY27 budget cycle. They reduced it to 39.2 million, which has ramifications for the budget we're operating, which we have to all be mindful of. I would point out that this board in this budget recommendation, you can see that for FY27, this board adopted a recommendation that we remove the early childhood infrastructure line item, which is one of 2 discretionary spending items in this budget. So we've already said we're going to find a way to operate without having that flexible line item in our budget. The only other discretionary fund the cabinet manages is the early childhood block grant. And the other line items in the budget are not, I mean, they are appropriated amounts. They're not discretionary. It's state match for the child care development block grant federal funding. There is also state general fund dollars that combine with the CIF funding to create that match. The Healthy Start home visiting program is money that KDHE uses to operate a form of universal home visiting. The infant toddler program is Part C services. This is again part of our federal matching effort to maintain effort. So you go through those line items, and there's going to need to be a discussion about the trends that we're seeing, but there's just we've worked on the overhead side, we have reduced an FTE. We've negotiated our agreement with KU. We're in a contract cycle that reflects some cost savings as we have been able to complete certain special projects. We've been scaling back where we can in terms of that kind of administration, but the line items are what they are, and these are all appropriated in the budget process. So just I think it's an important call out. Thank you for mentioning it. I would just leave it at that. We have an open RFP right now for the early childhood block grants. I think grantees need to be mindful as they are creating their grant plans that there are some challenges that may or may not affect that line item in the budget. We'll just have to wait and see. And I would just point out that I am happy to work with the legislative budget committees and lawmakers, and we can offer insight and guidance as to the budget we operate, but this is what it is. There's also some transfers directly from the key fund before it ever gets to the CIF that we need to be mindful of that go to other agencies. And I would note that we have been working to reduce spending where we can. So there have been unspent funds that lapsed back into the particular line items that, we should be having a conversation about how we manage those funds. In the KLRD budget tables, they look to be increases in spending authority. In my mind, it's a reduction of the key fund transfer that needs to happen using that leverage. The one line item I would call out is the Imagination Library. We are hitting enrollment limits with that budgeted amount. And if we want to keep growing the program, that would be a line item where I think it would be smart to allow the carry forward to help support the program. We had we weren't quite as enrolled. We had fewer kids enrolled last year. So as we've grown into that 1.5 million. We're going to hit it in FY26. So if we don't have additional funds in that line item available to support the program, we would have to cap enrollment and not allow new families to enroll. So lots of considerations, lots of work ahead for the budget process, and willing to stand by and be a source of information for those of you with those decisions to make.
Yeah. Thank you. I appreciate that, especially with that flexibility in like early childhood block grants and then that infrastructure. And I think like as we like one of the things my constituents, it's access to affordable, high quality childcare. And the fact that we've opened up or added 802 staff, like I think this is something that we have to address. So thank you for sharing.
All right. On my screen, I see 3 hands up from Tori, Renee, and Leetta. Tori?
Oh. Can you hear me now?
We
Yes.
can.
Okay. I don't know what was going on. So my question, thank you, Mr. Chair. My question is on the Dolly Parton Imagination Library. The 65% is the goal that you want to achieve. I do want to note that I saw Comanche County has 100%, and that's in my Senate district, so very proud of that. The question I have is, what are you doing to get to reach that goal? Is it a partnership with the hospitals, so forth? And then to kind of piggyback off of Senator Sykes's question, what you guys brought up about Imagination Library, is, are you seeing, how many are going to age out and then move those next ones up? So does that make sense what I'm asking, to kind of when you're talking about reaching your peak moving forward? So kind of a snowball of a question right there in Imagination Library.
I love it. Yes, we see every month we get an invoice from the Dollywood Foundation. What we're paying for is postage and book printing costs for the children enrolled in Kansas. And it's a detailed breakdown. We can see the number of new children enrolled and the number of children who are graduating out, because new enrollments are welcomed with one particular book, The Little Engine That Could, and graduating children receive a book title called Look Out Kindergarten, Here I Come. So those are specific line items in every invoice report. And then there's age bands for the rest of the enrolled children. So each month we can see the number of new enrollments versus the graduates, and we get to the net enrollment number that factors in both. So it is, I think every day there's probably somebody enrolling their child and somebody's child celebrating their 5th birthday. So that is that when we're reporting these numbers, we always have to lock it down as of a date certain, because it's a number that can fluctuate daily. But we have seen a progression of steady growth to get more and more children involved in the book gifting program. We have a network of local partners in this program, so they end up doing the lion's share of the recruitment of new families to join the program. But we have also tried to support the program. We in past summers we've done billboards along state highways. We have put posters. We've partnered with the Pediatric Association. They provide their members with posters for their exam rooms and offices. It's got a QR code and so that families can sign up for the program at their well checks. We have partnered with the military to do special events in it was the summer of 2024. They had our bookmarks and information about the program to give to families at the social events that they put on. We've also done there's Child Magazine. We've done ads in their quarterly publications put out by Child Care Aware of Kansas. The problem this year has been, as we've bumped up against the budget line item figure, we've had to curtail active advertising because it puts pressure on our local partners and the budgets they have, as you know, when we get a big boost of enrollment. So that's where the 501c3 side of this comes into play. We're trying to ramp up fundraising to put in place another resource to support the program from the private sector, to create a public-private partnership and have funding available. So we're starting to submit applications for different grants and seek out sponsors who might be willing to make contributions to the program privately, so that we are putting a sustainability plan in place for long-term growth. Kudos to those counties that have met or exceeded the 65% goal. That's what we want to see. That is, it's a uniquely wonderful opportunity for families to add to their libraries at home and read with their children. So does that answer your questions?
Yeah, so is the 65% a children's cabinet goal, or is it like a imagination library goal? That's
what the Dollywood Foundation has been operating this program for several decades, and that is what they have found to be the sweet spot for what they consider full enrollment, because this is a matter of choice, and not every family is going to choose to enroll their children. So they have found that 65% represents a really good target goal.
Great, thank you so much.
Mm-hmm.
All right, thank you, Tori. And with your permission, I'd like to ask a follow-up question. But first, just parenthetically, Lane County's at 63%. I'm going to make some calls. We're so close. We need to be in green.
Yeah.
But my question, looking at Southwest Kansas and knowing which counties have a significant Hispanic population, I note that those counties have a low participation rate. So really two questions. Are the books available in Spanish, or is it a problem with outreach into the Hispanic communities?
Great question. We were chosen this year by Dollywood Foundation to help with phase 2 of a program that they piloted with California, because California is their largest state that is doing this statewide. So their beta testing was with California. We're in round 2 of states that were invited to offer the program, the books in the program. The parent can go in and check a box to get bilingual versions every month. So the books come with English language and Spanish language side by side on every page. And that is, we're trying to make sure there's awareness of that. And it is at the time of sign up, or you can go back in later on and adjust your enrollment if you signed up before that was a feature. So it is a question of making sure people have awareness that this is an option. You do have to have a Kansas address. We get asked all the time about grandparents in Kansas who want to sign up their grandkids who live elsewhere, and that we need a permanent residence for the children in Kansas is how the system works. So I don't know if it's, a more transient population. I'm not quite sure how to identify the reasons for lower enrollment in certain areas, but we certainly want to help spread the word. And I should mention that we've equipped our Department of Corrections with flyers that can be used. You can always use the online sign up, but what we created was a flyer that can be printed, and that paper registration can be sent to us, so that families who have a loved one who's incarcerated this is a program that we're hoping that among that network of families can take hold to make sure that those children have opportunity to receive these books as well. So we're always looking for ways that we can partner. We're attempting to provide, we have bookmarks that we can provide to birthing hospitals, negotiating to see if we can, if there are partners willing to team up with us in that way. So that hasn't taken off yet, but we're working on it.
Sorry, I was muted. Question from Renee now.
Thank you, Mr. Chair, and thank you for the update in the annual report. Just to follow up on Senator Sykes and Senator Blues, two questions real quick. Do we know how many children are in both the Dolly Parton Imagination Library and ECBG?
Yes, we've got our data sets matched. I don't have that off the top of my head to answer you live in the moment, but we do have, that was the report. We did the deeper dive in 2024 and the evaluation that Jessica alluded to, which is on our cabinet website, and we should be able to provide, I can email that to the board.
Great.
Yeah.
And I think it's so encouraging to see those great early literacy data. As most people know, we are really focusing on literacy. So my follow-up question is, it's great to see those early childhood numbers increase, but do we know why we don't see that translate into elementary literacy proficiency results?
It's interesting, Senator Sykes, is Dr. Watson gave a presentation that it shows results kindergarten, I think actually pre-K through third grade. And it was I think it's a presentation worth taking a closer look at. It shows similar that spring or that fall to spring shift in growth and improvement, or in terms of risk categories when it comes to the literacy skills. And it's illuminating. It shows I think his focus is the summer period where kids have that summer slide, because they're not focused on those things over the summer months. They come back in the fall. So when you begin, I'd love to get us to a point where we're matching our early childhood data and looking at the continuum from an even earlier age. But you do see improvements in, between where kids are in fall. There's growth and improvement shown by spring, and then you come back in the next grade level and there appears to be some lag, and there you see a plateau in as kids start aging up, second, third grade, you begin to see there still is growth and change, but there's a little less movement. So I don't have those answers. I invite Amanda to offer thoughts if she's on the call, but we can get more information. That might make an interesting presentation for this board in February at our meeting to really take a look at those findings.
It would be helpful if we had that, and also if we could figure out how to carry that momentum, higher up into our K-12 system would be awesome. So thank you, Mr. Chair.
Thank you. Next question is from Leah.
Thank you, Chair Hyman. And Senator Erickson, I fully agree with you. I would love to figure out, is it the summer learning loss? What is it? So I edify your remarks. Back to the adjusted consensus revenue estimates. Oh no, I just hate to hear those numbers as you say them, Melissa. Is there a way for us to have just like an executive summary of the money being removed from the key fund before we even see it for purposes other than children's cabinet programs? I'll just say that, grants or investment into the lives of children. Like we talked about the Attorney General's office receiving funds. I'd love to see a succinct list of where the dollars are being diverted. And then I just want to say again to this cabinet, which I probably am preaching to the choir, but we must end the practice of diverting dollars away from the very purpose for which they were created. The Master Tobacco Settlement Funds were intended by the early Kansas legislature in the 90s to be directed to support children and families in our state, and not to backfill gaps or in the general fund or to replace core obligations that the state should be funding. And I think it's our obligation to advocate that these settlement funds that should go towards our children. I mean, they exist because of generations of Kansans suffering the consequences of tobacco use. So it's only right and responsible that the dollars generated from that history be used to improve the health, the education, the well-being of today's children and families of Kansas that was originally promised when the Children's Cabinet was created. So Cabinet, we must remain steadfast in protecting those dollars and honoring the legislative intent and ensuring that every dollar truly works for Kansas kids and families. And I believe Kansas families deserve nothing less than that. So, Melissa, is there a summary that exists of the nature that I just described?
Yes, KLRD does a fantastic job of publishing materials. So there is a memo about the tobacco settlement that I can send the board. There is the latest key fund and CIF budget tables that I'll make sure you have. And then it's hefty. It's the history, the historic transfers that since inception. It's a spreadsheet. It's usually updated by about February. It'll show transfers, but I will gather resources that I can provide to the board.
That would be helpful. I think it would be great to see the cumulative effect of these amounts being taken annually. Melissa, do you know when they started shifting dollars away? Was it right away or did it happen?
It's been since inception. There have been different forms of fund transfers that ebb and flow. The current line items that transfer directly from the key fund elsewhere began in 2014. So, you know, we know we had some state budget stresses at that time. But I'll get those materials gathered and out to you guys next week. I will make that a priority.
Thank you. And I just need to note, I have to leave in 8 minutes. We're interviewing city manager candidates for Olathe. So I don't know if there's a vote that you need before, or you have quorum without me, maybe?
We do have quorum. And I want board members to if there are more questions, we want to make sure we have a fulsome discussion, but
if I slip out, it's because of that reason. Thank you, guys.
Okay, thanks, Leetta. We will try to get to the point of having a vote before you have to leave. But we do want to answer all the questions that come up. Amanda popped up on my screen. I was wondering if Amanda had follow-up to Senator Erickson's questions.
I did. Can you hear me?
Yep.
Fabulous. Well, thank you. I really appreciate the conversation and the focus on early literacy. And I think that the findings that the cabinet has been able to produce, that when we are able to look at children who receive both high quality services from Early Childhood Block Grant and the intervention of Dolly Parton Imagination Library, that together that can lead to some pretty significant outcomes. I do think that when we look at this data, it's helpful for us to remember that we're looking at a fairly small subset of the children in the state. So it can be challenging when we're comparing multiple data sets. When we look at this data and we see good results for this small group of children, and then we look at a, say, third grade ELA assessment that includes an order of magnitude of much more in terms of the number of children, that we don't yet know. We are working on the processes together with the cabinet to be able to match that data, but we don't yet know whether the results for those children who receive both Early Childhood Block Grant Services and Dolly Parton Imagination Library, whether they might be better than what we would see in our state as a whole. We are, as I noted, working on that. We have a draft data sharing agreement between our two agencies that we're working through for Early Childhood Block Grant data. And similarly, the Children's Cabinet is working with the Dollywood Foundation to be able to share that Dolly Parton Imagination Library information externally so that we can then match that into our data set. Certainly, these results are really promising when we would consider what can give children the best possible start to begin kindergarten in a strong position, because as Melissa alluded, as we are looking at some of our data, it's indicating that it is challenging to close the gap between children who are at risk of struggling to learn to read early and those who are not. So I hope that answers the question. And certainly in our agency updates later, I'm going to be sharing some additional work that is underway to help focus on early literacy. And certainly I'm always glad to be able to bring back other data or additional information for this group.
All right, thank you, Amanda. Further questions? Senator Sykes?
Thank you. Amanda made me think of a question. So do we have in place what we need to make sure that we're able to share that information to track and kind of that longitudinal study to show that these early investments in ECBG and Dolly Parton, that they are putting us on the trajectory that we want for our state? I guess I'm just saying, like, do you have everything that is necessary, or is there something that maybe legislatively needs to be done to make sure that we're gathering that data and it's good data for the future? That was a very terrible question.
No, we do consistently, the Kansas Student Data Privacy Act does create some real limitations for our ability to share data out. And it also means that we take a very thoughtful approach to any data sharing agreements that we execute. So that's a persistent challenge. Our current approach is that we're working to say, okay, if we as an agency cannot share data out easily, how might we be able to bring that data in? But then similarly, Melissa can speak to then the challenges of working with the Dollywood Foundation to be, or not the challenges of being able to make sure that we can share other data. Everybody wants to make sure that we are keeping data about children and their families and their situations very, very secure. And so it just, it does take some time to be able to work through those legal agreements to make sure that we have what we need in place. The technical piece is not difficult. In the pilots that we've done, when we're able to match data, we're able to do that in a matter of days or weeks. It's the other adaptive challenges of having the framework to share the data that can be a challenge.
Yeah, I concur. We are the stewards of the data related to enrollment in Imagination Library and need Dollywood Foundation permission to share it with the Department of Education. We envision call it a checkbox that these children were enrolled. Ideally, duration of enrollment would be another data point that could be shared. I'm not free to share that enrollment data unless and until our proposal receives approval. They are actively reviewing what we're proposing, and I hope that we get to a good outcome and can share that data with KSDE. We have already, we're working in partnership to share early childhood block grant data into KSDE's system. Logistical challenges, legal challenges, we're working our way through those issues together.
Thank you.
All right, further questions? Further questions? Seeing none, we will proceed to a roll call vote. This is for adoption of the draft of the annual report. Do I hear a motion?
So moved.
Second.
Motion's been made and seconded to adopt the draft report. Dave Younger.
Aye.
Representative Laura Williams.
Aye.
Representative Suzanne Weichel.
Aye.
Dr. Tara Wallace.
Yes.
Senator Dinah Sykes.
Aye.
Tabitha Rossbroy.
Aye.
Dr. Leetta Felter.
Aye.
Senator Renee Erickson.
Aye.
Senator Tori Marie Blue.
Aye.
And Chair Don Heineman also votes aye. The motion is adopted. And we got it done before you had to leave, Leetta, so thank you.
Thank you. See y'all later. Merry Christmas.
We will now move to agency updates. Amanda Peterson with KSDE.
Wonderful. Well, thank you, everybody. I have a few updates to share today, and most of them do actually relate to early literacy. So I am so excited. This week kicked off our series of Kinders Can conferences in the state of Kansas. This is a partnership between several of our education service centers, and it is a one-day professional learning event for early educators. So as the name suggests, it has a very great representation of kindergarten teachers, but it also welcomes preschool teachers and first grade teachers and parents of teachers, parent educators, and other early childhood educators. And this year, the focus is all around early literacy. So there is a terrific keynote focused on oral language skills. We know that oral language, talking and listening, is the foundation of later reading success. And so being able to help teachers think about the ways that they can expose children to a really wide and varied vocabulary and interesting sentence structure, and be able to have extended conversations with them so that children can practice those talking and listening skills is really, really helpful. And then there's a series of terrific breakouts on helping teachers really build their skills to be able to deliver instruction in the ways that young children learn best, right? We know that skillful teaching for a classroom of 4-year-olds looks very different than skillful teaching for a high school classroom. And it's wonderful to be able to bring together early educators to be able to help them hone their skills in that area. So this week we were at Greenbush, in Girard, and in Lawrence. Next week on Thursday and Friday, we will be at ESDAC in Hutchinson. ESDAC is the original home of Kinders Can. And I think there are still a few slots available. So if anybody would like to attend and has the ability to get a substitute teacher next week, Thursday or Friday, you can register on the ESDAC website. And then I'm really excited that this year we're also coming to Southwest Kansas. So the Southwest Plains Regional Service Center in Sublette will be hosting a Kinders Can conference on April 10th. So we have that piece. This is also our second year of working through our new system of school accreditation in the state of Kansas. If you haven't heard me talk about this before, we have shifted our system of accreditation to really helping school systems focus on the fundamentals of quality instruction, of teaching and learning, so that we can drive improved student outcomes. So every school district in the state comes together and develops an action plan that is focused on one of the 4 fundamentals. Those 4 fundamentals are structured literacy, so helping children learn how to read. Standards alignment, really making sure that schools have a strong understanding of what students know and are able to do and are teaching to those standards. Balanced assessment, helping schools use data in an effective way to drive instruction. And quality instruction, making sure that schools have high quality instructional materials and great expectations in classroom practices. So last year, schools developed their first action plan. This year, they come together and they reflect on how that first year of implementation went and use that to develop their plan for the next year. So it has been terrific to see those school improvement days get underway. They come together for a day of learning collaboration together with peer school districts, and we're really excited about the ways that is progressing. I do have some exciting Parents as Teachers news as well, and we've been sharing these in KSDE Weekly, which is our Thursday weekly Kansas State Department of Education newsletter. Anybody can go to ksde.gov and sign up, and I'd encourage you to do so. But our Kansas Parents as Teachers programs are supported by both our state agency, state office, but also the Parents as Teachers National Center. So every one of our Parents as Teachers programs is an affiliate of that National Center, and the National Center supports them in maintaining really high quality services. So programs have the ability to go through, I'll call it an accreditation process, their quality endorsement and improvement process. And it's a really intensive year-long effort where they provide information about their policies, their data, and really go through a serious self-review across a number of quality indicators, and then have an external review. In Kansas, we have about 60 Parents as Teachers programs. As of this year, we now have 42 of those programs operating at the blue ribbon status. So programs can either be model, which means that they are meeting all of the essential requirements and providing great services, or blue ribbon means that they are going above and beyond to really show that they have an excellent quality. And I am just so proud of our Kansas programs who have achieved that honor. So now we had 11 new blue ribbon programs be awarded this year, and so now we have 42 Kansas Parents as Teachers programs operating at that blue ribbon status. But that's not all. We also received some really incredible accolades at the most recent Parents as Teachers National Center national conference in the state of Kansas. And it is really incredible to say that George Vega from USD 202 Turner was named the International Parent Educator of the Year. So of all of the thousands of parent educators all across the world who are delivering Parents as Teachers services, George Vega was honored as the Parent Educator of the Year. And for the first year ever, there was a Parent Choice Award which is an award nominated by parents in a program. And Brittany Brake from Growing Futures in the Shawnee Mission area won that award. So that is just a really incredible testament. Two of our many parent educators in the state who received well-deserved recognition, and we are so proud to be from Kansas. I'll say I was not at the conference, but was following along on social media and seeing, I think there were maybe 4 or 5 people total who were awarded. Seeing 2 of those from Kansas when there are thousands of parent educators across the world is just pretty incredible. So those are our most exciting updates. We also have our Kansas, we talked about the Kansas preschool pilot earlier. That request for proposals is out. Given the current status of funding and other considerations, we're focusing this year as a renewal opportunity. And so our Kansas preschool pilot grantees have the ability to renew their funding. And then if we have any additional funds available, we'll award that on a competitive basis. We have a webinar next week on Wednesday, December 10th at 10 a.m. and 2 p.m. if anybody is interested. And then those applications are due on Wednesday, January 21st. So if anybody has any questions, please do let me know.
All right, thank you, Amanda. Moving on to Craig Barnes from KCCTF.
All right. Good morning, everybody. Hope everyone's staying warm today and this week, really. Really only one update, addition to the annual report update that you already got from the cabinet perspective. So our state fiscal year 27 early childhood block grant application window has opened. We started November 17th with a very successful webinar in which we had over 100 people registered to attend. The RFP itself is live. It can be found on our Children's Cabinet webpage. That's kschildrenscabinet.gov. And you can find that under the About drop-down tab by clicking on the Early Childhood Block Grant. For anyone who may not have been able to join that webinar on the 17th, there is a recording and the presentation slides are also made available on that webpage, so anyone can go back and watch that and see the nice update that we had to kick off the application window. So for organizations that are interested in applying this year, applications, as usual, are to be completed by using the Kansas Common App platform. All the links to the Kansas Common App and the helpful guidance for those for completing the application are also all available online as really helpful tools and resources to complete that application. Application window closes January 8th of next year at 5 p.m. And we're just really looking forward to reviewing this upcoming group of applications and then look forward to having a slate to present to the board in our April 26 board meeting. So with that, that's the only update that I have before Melissa will have a couple more from her director's update, but I'll stand for any questions.
Any questions for Craig? All right, seeing none, thank you, Craig. We'll move ahead to Matthew Billinger from KDOC and JJA.
Good morning. I wanted to let you know one of my hats I wear with the Juvenile Justice Oversight Committee. We just finished our annual report and published it in November. It's available at the KDOC website under Juvenile Services and Juvenile Justice Oversight Committee, which makes me appreciate your guys' annual report. It's always very impressive and well thought out, so good job on that. We have an exciting update at our Topeka Correctional Facility. That's our women's prison in the state. Thanks to funding from the legislator and the governor's office, we've been provided a much needed medical services building at our facility. And part of that, they're drawing up for different plans for consideration, a nursery unit. I've talked about this in months past, but that nursery will be part of the new medical building. It will be a 10-bed living unit, so the residents there will live there for a time. Those that come to our facility pregnant and will deliver while serving their sentence. This allows them to keep their newborn in that unit for a period of time immediately after delivery to help form that bond between the mother and child bond. The details are still being considered and designed. We did want to thank some community partners, Topeka Doula Project, Kansas Breastfeeding Coalition, Kansas Action for Children, and Ministry to Incarcerated Families. They've been providing input and a partnership in this initiative. And those meetings are continuing on to shape how this is going to be realized. But they're drafting policy, working on the application process and how that program is going to look. After looking at other states, we found that reports indicate that a reduction in recidivism or reduction in committing new crimes is tied to that strong mother-child bond. So by helping build this bond early, not only are we helping to deter future crimes in the state, focusing on that public safety piece, but also supporting that bond in its important early stages. In addition to that, we have the Lullaby Project, also at Topeka Correctional Facility, that pairs incarcerated mothers who are either pregnant or have children under 2 years of age with artists who write and sing personal lullabies. And then those are digitally recorded and sewn into quilts that are given to the children at home while their mothers are away. This is a grant-funded program. We partner with Children's Discovery Center in Topeka. Earlier in the summer, I think we had 6 residents were chosen to participate. And then about a month ago or so, the quilts were given out during a celebration with those families. So kind of getting that early bond there, doing really well. Not so much related to child development, but I was excited. We're starting to do food hubs. So a lot of our adult facilities have gardens and they produce a lot of food. And they started creating local hubs to donate to different organizations and different distribution places. So some of that food that we produce in the facilities can get out and help with that issue in some of our local communities as well. There's large thoughts and ideas about creating an actual processing plan and getting that further along. So that's something that they're looking at doing so that you can actually process that and send it out with a longer shelf life. On the Juvenile Justice Oversight Committee, we went through our expenditures and our budgets throughout the year. We're happy to announce that a lot of the grants that we provide will still be there in FY26 and 27. Years after that are a little uncertain due to some possible legislative action going on and how much we actually spend. Similar to what we talked about earlier about those unexpended funds always kind of make planning a little complicated. But that's something that we're going to be watching closely. And some of our community partners are getting a little nervous about that, but we know that we're going to at least sustain the next 2 fiscal years. So that's my update for you today, and I'd be happy to take any questions.
Any questions for Matt? All right, seeing none. Thank you, Matt. Looks like you had some very interesting projects in the works. So thank you for that. Moving ahead to Derek Burlott with KDHE.
Right. Thank you, Mr. Chair. Good morning, everybody. Good to see so many of you virtually. Just a couple of updates for everyone this morning regarding the early childhood work here at KDHE. My colleague Amy Dean has other commitments this morning, so she's unable to attend, but I didn't have any updates from her. So we're okay there on the maternal child health side, I should say. For me, on my side of the work here at the agency, obviously we're very happy and excited that the federal government is back open, especially as it pertains to our WIC program that we administer throughout the state. So we have received our allocation for the year, and we're able to make those awards out to our local agencies. Our local agencies across the state are really the ones that support the clients or the mothers and children directly. And so that's where those clients are going to receive their EBT cards, do their required appointments, their nutrition assessments, nutrition education, and the like. And so we're very happy to kind of receive that sustainable funding so that we can plan throughout the federal fiscal year for our WIC recipients. So great news there. Regarding childcare licensing on the regulation front, we are working with the Attorney General's office currently, both to update our school age programs, and that's kind of in the same realm as youth development program. There's some verbiage that was in House Bill 2045. And so again, the purpose of that package is to make those programs eligible for federal assistance funds, for childcare assistance funds. So we are working with them on that. And we are also working with the Attorney General's office on a compliance package for House Bill 2045. And so some of the language that needs updated specifically in regulation that was dictated in the bill. We are working with the Attorney General's office to get that language finalized and stamped from all the necessary parties. We will still yet have to go through a required public comment period and a public hearing. So 60-day public comment period kind of culminizes in a public hearing. And so we'll still have to go through all of those statutorily required routes as well. As was mentioned with PDG, with the Preschool Development Grant, I think we're really excited about the Child Care Zones project. So we've been able to do a lot of different, well, we've been able to give out the funds, I should say, for others to do a lot of cool work. And so if you're familiar with kind of KDHE's aid to local grant process, we are big believers in making grant funds available for communities to utilize them kind of how they determine best. And that's what we had heard for the past several years was, you know, this corner or this location of the state, they may have this idea to assist in the childcare needs in their area, but it's a totally different approach or a totally different idea in another corner of the state. And so through the PDG grant, through the Kansas Children's Cabinet and Trust Fund, we were able to make funding available, have what we call child care zones apply for that funding, tell us how they wanted to use it, and then based on those applications and technical assistance, award those funds to those zones. Again, just as a reminder, a zone is a self-defined geographic area, so we let them tell us who they want to support, but it does have to be at least 2 Kansas counties. And then we're able to grant them those funds to do a variety of initiatives. We have, I think, 7 grantees to this point, lead grantees, and then again, they support numerous counties. I won't list them all for you here, and I won't list the initiatives, but we are working on a kind of a flyer of an update that I think will be able to be provided. But it's everything from recruitment and retention bonuses for the workforce, specifically. There are some employer engagement pieces in there that some counties are choosing to do, kind of separate from the other support for a substitute pool. There are counties that have engaged in substitute pools of their own. We have mentorship and substitute networks. There's kind of a coordinated hub planning, and so one of the ideas was like administrative support from a centralized hub that could support multiple licensed facilities, non-traditional hour incentives. We know that's a big deal. Some wage supplementation ideas, which we've noticed has really been regional as well. We've got, I see some endowment funds listed on here, and then establishment of other regional hubs too. So I think we're still a little bit early to note what we're going to learn from these, but the program to this point has been great to hear. And you know, again, I think just trying to show that local support works. And so we want to get that data back and be able to provide that information for future utilization, but we'll continue down that path. And we have a team that's focused on implementing that, providing technical assistance to those grantees, answering their questions, routing funds, all of that fun stuff. So I think with that being said, Mr. Chair, I will relax for any potential comments. I think I see a hand.
All right, thank you, Derek. Yes, question from Senator Marie Blue.
Thank you, Mr. Chair. Derek, this may be old news and I'm just behind. But I know there's been a lot of talk, especially in rural Kansas, about multi-use buildings with fire marshal and wanting to do maybe childcare on the bottom and then apartments up top. Are you running into those issues still? Or I know the fire marshal is trying to create a new Kansas code to bring everything up to date. And I'm just kind of curious if you're running into some of those issues and what the status is.
Thank you, Senator Blue. Not that it made it to my desk, I will say. We of course come across issues, and to be honest, we've just been able to have sit down or maybe virtual sit down meetings like this with the fire marshal's office and with those, what if they're licensed or if they're wanting to be licensed, to kind of work through those requirements directly with them and maybe through some of the misunderstandings. I think they're still trying to update the code for the state. And I would be speaking out of turn if I told you I knew where that was at in the process. But I haven't, to be honest with you, no, I have not heard a whole bunch about fire marshal specific issues or fire marshal specific barriers. So that's something that's always top of mind for us. But their office has been really great about just being open to meeting, and I think also educating us on their perspectives as far as life and fire safety. So I don't think that probably directly answers your question, but just to say I haven't heard a whole lot, to be honest with you. But I can certainly do some outreach with our team, our field team specifically, to see if there's things maybe they are tackling that haven't necessarily made it up to me, so to speak. So I'll do some checking for you.
Okay, I just know that there's been issues about dual occupancy for a building, and so I know that childcare has been one that in these rural communities that they're trying to do, again, apartments up top to utilize to get some funding to come in, and then childcare maybe on the bottom, so forth. So I just was curious on that. Thank you.
Yeah, absolutely.
Further questions? Seeing none, thank you, Derek. We'll move ahead to Brandy Wells from KBOR.
Mine is sweet and short. I don't have an update from the Board of Regents that trickles down this far. But as a mom and a participant of the Dolly Parton Imagination Library, I'd just like to express some gratitude and wish everybody a happy holiday.
All right, thank you, Brandy. Good to have that feedback on Dolly Parton Library. Moving ahead, Justice Melissa Standridge.
I similarly have no update here. We're just chugging along on, some of our projects that came out of the Child Welfare Summit.
All right, thank you. Moving on to the director's update. Melissa, are you still with us? I haven't seen you on my screen for a while.
It's nice when there aren't questions that involve me. Thank you, Mr. Chair. And I want to thank the board for your work this year, and to those of you who arrived mid-year, I thank you for the time and attention you've given to onboarding and getting oriented to the work. Those of you that have been serving with us, we appreciate your ongoing focus on the work the Children's Cabinet does with our Children's Initiative Fund budget and the support that you offer. There was a question that I neglected to make clear. We will provide a finalized report. We print hard copies. We try and get a feel for how many we might need. This will live digitally, of course, on the website, but we know that oftentimes it's helpful to have a hard copy. So we will make sure that every cabinet member receives at least one, but if there's reason you wish to receive more than that, please just let us know so that we can factor that in to the count. We'll do that. I also want to make clear there will be final copy edits, and we'll make sure the document is clean, but I appreciate the vote to adopt the report. Very much appreciate the effort that goes into the work on the KU team side to pull all of this together throughout the year. We really start the framework in summertime to keep an ongoing list of components, but it does sum up the work this organization has carried out through the year. So thank you for all of that time and attention. I just want to note, Derek mentioned it, the federal shutdown presented some day-to-day challenges, but overall we navigated that period of time successfully. All of our grants, the payments have been processed and things are in order. And I am appreciative of the fact that our group of federal project officers are back on the job. They were missed. They provide help throughout the course of doing business with these funds. And so we're happy to have them back. For me personally, as director of the cabinet, it has been the season of convenings. So I've represented the Children's Cabinet at the National Children's Trust Fund Alliance annual meeting, which this year they held virtually. Craig and I attended the CBCAP annual TA convening. It was a really beneficial day and a half meeting in San Antonio with other states to talk about the way we utilize the community-based child abuse prevention funding to promote child well-being, and really kind of looking at the systems level role these funds play. So I was invited to present on some of the work that Kansas has done with our CBCAP funds. It's always nice to have our work recognized in those settings for being interesting and you know, good opportunities for other states to learn from the work we're doing. Just got back from the Education Commission of the State's Winter Commissioners meeting. Similarly, I was asked to present there on behalf of Kansas efforts to support the childcare workforce. So that was a good meeting. Again, day and a half, short and sweet. Feeling the effects of lots of travel, but in state, we've been doing site visits with our capital projects fund grantees, and we helped Humboldt celebrate ribbon cutting on their CPF facility. Notably in the health, these are the community facilities that support work, education, healthcare, provide broadband, and have childcare components. Humboldt has an X-ray machine in their new health clinic. I think they said it's the first time in 10 years that their citizens don't have to drive somewhere else when somebody needs an X-ray. So they were super excited. It's a really comprehensive set of programs and services and partners under one roof. So that was fun to celebrate with them. The last CPF project to break ground did so in October. We did a site visit. They had a ceremonial groundbreaking last year, ran into some historic society. The preservation board process took a little longer than anticipated, but Storytime Village in Wichita construction is underway, and we're excited to celebrate with them in fall of 26 when they get to opening. A group of KSDE from the information technology service side, and several of us from the Children's Cabinet, KU CPPR world, went together and participated in the Early Childhood Data Lab, which this year the national convening was held conveniently in Kansas City. So we spent several days together exploring the very questions this board had. So we are actively looking for the path forward to be able to provide the kind of resources in terms of research and evaluation on the impact for Kansas that our early childhood investments are having on outcomes later on. So it's been a busy period. I'm looking forward to wrapping things up for the year and taking some time over the holidays to recharge, do a little regrouping and preparation for the session ahead. I think, Mr. Chair, I'll leave it at that. There is one final decision point for the board today related to the 2026 meeting cycle. We had a quorum at the October meeting, but only just. We had 6 of our 11 members present, and we opted to defer the adoption of our meeting schedule for 2026 until more of us were gathered together. So we have historically met on the first Friday morning of alternate months, so that we end up with 6 meetings a year on a cadence that is workable for you as board members doing this as a volunteer extra duty, but also serves the work that we're doing. So we really kind of need to hit these timelines to keep the cycle of evaluation and reporting and administration of our programs moving on the cadence that is necessary. The April 3rd meeting is the highlight because that falls on Good Friday. And I know for lawmakers who are serving on this board, Friday is an intentional day chosen because historically, usually Fridays are an easier day during the legislative cycle. We are keenly aware that there may be reasons why we aren't going to have a quorum if we hold a February 6th meeting because of some constellation of legislative responsibilities that are happening. So we adopt the calendar, understanding that, in human terms, there may be reasons we have to make adjustments. I think my ask is that we have some discussion, Mr. Chair, on the April meeting. I don't want to disrespect the fact that it is Good Friday. I also find that we have some challenges with other dates in the month of April. And I'm wondering what the will of the board is. The following Friday, April 10th, is scheduled to be, I believe, sine die, so that would not be a good alternative. The third Friday is in conflict with our early childhood recommendations panel meeting, which meets that third Friday morning. And later than that begins to press on our grant making cycle for the early childhood block grant. So I'm going to turn it back to you, Mr. Chair, to coordinate discussion among the board about how we want to handle our April meeting.
All right, thank you, Melissa. We do want to be respectful to people's activities, given the activities that might be going on in relation to Good Friday. But as Melissa pointed out, moving to an alternative is not an easy task. And the legislative calendar is in play as well. And yet it's also, as we know, very much in flux in early April. So no one can tell us at this point how that might impact a meeting on April 3rd. So we have a tough decision to make. And regardless of what decision we land on, I think we need to be flexible and recognize that we may have to move a meeting date even so. Suzanne.
Thank you, Mr. Chairman. I mean, can we just talk about the possibility of moving it to April 1st or 2nd? Just moving it up a day or two?
I would not have a problem if the board is flexible in that way. I actually don't have, I should, but I don't yet have the legislative calendar in front of me. So is that feasible? Are you guys off?
Yeah, I have it right here, and we're scheduled to adjourn the last Friday of March. So we're scheduled to not be in session on April 1st or 2nd.
Does 9 a.m. is there? I would say will of the board needs to can you weigh in and let me know if there's a preference to which day? Does Thursday at 9 work? I guess would be the question.
That works for me.
Input from board members. We're looking at April 1st, correct?
Or 2nd.
April 1st or 2nd. Moving to one of those alternatives for the April meeting. Does that create a problem for anyone?
I would just add to that maybe the 2nd would probably be best because of just not knowing the timeline of what time we get out of there, just to give legislators that day to either travel home or get resettled and then have it the second.
Yeah, we're scheduled to adjourn March 27th, so
okay.
it's
Sorry,
like several days. But yeah,
that's great.
And
Sorry, I had
don't
it
know
as adjourning the 31st. I don't have my session calendar in front of me either. So yeah, either one works for me.
The second, I think if I were to stick up for staff, the second would be preferable so that because the work that has to be done to prepare the slate of grants for your consideration, I think even a day or two is gonna create some wrinkles. So can we, is Thursday, April 2nd at 9 a.m. as
Mr. Chair, I can make that sort of work, but I would have to be in and out throughout the meeting.
does the first work better for you, Dave?
The first works better, but again, depending on what the group wants, but I could be in and out if there's a vote or something, but just to be there that whole block of time, I wouldn't be able to do that on April 2nd.
Okay,
I
further
appreciate
input
that
from
I'm
board
not
members?
I appreciate that I'm not a voting board member, but I will note that several years ago, a children's cabinet meeting did fall on Good Friday. And it was very easy for me to attend the meeting in the morning and then make it to a prayer service for the afternoon. And it was actually a really beautiful and peaceful day. So assuming that we do not anticipate that the board meeting would stretch well into the afternoon, it might be worthwhile to check whether keeping it on the 3rd does pose problems for anybody.
I put in the chat, but I can do the 1st, 2nd, or the 3rd.
Appreciate that.
I'm good with whatever we want to decide.
April 3rd is not a problem for me at all.
Same. I'm flexible, whatever is the will of the board.
Well, I'm starting to hear some momentum to just leave well enough alone and leave it on April 3rd, Good Friday. Does anyone have a problem with that? All right, seeing none, it looks like we have finalized our
Mr. Chair,
upcoming meeting calendar. We will proceed to a vote.
before we vote, Lindsay, can you put the schedule back up? And thank you. It is the simplest for us to hold the cadence of meetings. The one note that's not on here, would we try and do an in-person board meeting followed by a board retreat? Is June or August? And I think we found that August has more complications. Next year will be an election cycle too, so I want to be respectful. Would June 5th for an in-person meeting be something the board would like to entertain?
Melissa, I'm sorry to be the fly in the ointment today, but I've got a daughter getting married on that Saturday, so I'm not sure.
You can't join us.
I'm not sure I can get away with that.
I'm also
okay.
not available that day, June 5th.
Okay. All right. Well, let's table discussion of when we might do in person for now and keep it simple and adopt the dates, and then we can figure out what works for an in-person convening in 2026. Maybe it's one of the. Maybe it's February. Maybe it's April. We'll have to see, but it could be December. So
okay. All right. We will delay that decision, but in the meantime, we will proceed to a vote. I need a motion. Do I hear one?
So moved.
Second.
Motion's been made and seconded to adopt the meeting schedule for 2026 as presented. Dave Younger,
Aye.
Representative Laura Williams,
Aye.
Representative Weichel,
Aye.
Dr. Wallace,
Yes.
Tabitha Rossbroy,
Aye.
Senator Erickson,
Aye.
Senator Blue,
Aye.
and Chair Don Heineman votes aye. It is unanimous and the motion passed. That
Thank you all.
concludes
I've
business
sure
today, Melissa.
I just want to say thank you. I've appreciated the work this year. I want to thank staff for their time and attention. We've had some extra hurdles on the journey with some of the wrinkles with funding sources, but it's always a nice outcome to put the work into the annual report and sum things up. So I apologies for interrupting you, Mr. Chair, but I did want to close with a note of thanks to everybody.
All right, thank you. And I want to welcome and thank the new members of the board. I don't believe that I have done that yet. And I appreciate being at full strength today. That's commendable. So thank you all for making that effort, and just look forward to working with all of you during this coming year. With that, happy holidays. I hope you spend significant time with friends and family, and we will see you in February. With that, the meeting is adjourned.